Life is very different these days than it used to be in the olden times. We're all leading much, much busier lives, and of course lots of us work quite a long way away from where we live. That can mean it's quite difficult to see a GP, even if you can navigate the receptionists and the appointment system. But fortunately these days there are lots of things you can do before you go and see your GP. And if you follow some of these tips, you might be able to avoid seeing one at all. Firstly, of course, we've got the World Wide Web. The big question is whether you can trust what you see on it when you look something up. Plenty of pretty scary stuff out there, not to mention some pretty wacky ideas. But if you go to a really reputable site like patient.info, you know that all the information on there, all the information leaflets are written by GPs, for GPs and their patients, so you know you can trust what you're getting there. They may be able to tell you what you've got and buy yourself a little time so that actually you know the chances are your symptoms will settle down and you don't need to book an appointment. Secondly, could you need a medication? Well, these days things have also changed from the days when GPs were the only ones who could prescribe most medications. We've got a huge number of medicines these days which are available without a prescription. Some of them are called GSL, General Sales List, and you can buy them in the supermarket when you're doing your weekly shop. But others, we do need a healthcare professional to tell you about whether it's safe to use them. And that's where your pharmacist comes in. The pharmacist has a huge list these days of so-called P medications. They're ones where the pharmacist does a consultation and he can advise you if it's safe to use this treatment first. Maybe things like conjunctivitis, even acid-suppressing medications that used to be available only on prescription, thrush treatments, all sorts of other medications may be available without a prescription from your pharmacist. If, on the other hand, you don't pay for your prescription charges, talk to your pharmacist about whether or not they run a minor ailments scheme, because actually many of them may be able to offer you a prescription with your GP's signature got later, and that means you don't have to pay for the medications if you get free prescriptions. If it's a chronic disease, if it's something like immunisations, or maybe if you want a health check, you could ask yourself, do you need to see your GP at all? Could you see the practice nurse instead? Practice nurses now do an enormous range of work. They'll look at most of your immunisations, and indeed they probably know a lot more about them than your GP does. They can help enormously with diet, lifestyle advice, all that sort of thing. They can monitor your blood pressure. They can assess your risk of having a heart attack or stroke if you haven't got one of the Patient UK mobile apps to do it for you. And they can do lots of monitoring and often even offer prescriptions for ongoing conditions like asthma, heart disease, diabetes, and so on. If you've exhausted all of those, maybe you don't need to see a GP, but you do need to speak to one. Well, have a word with your practice and find out when the GPs take phone calls from patients. Pretty much every practice these days runs a telephone consultation system. You can phone in at a certain time and either get put through to the GP, although that sometimes involves a wait, or the GP will ring you back if you give them your number. But that does mean, please, making sure that if you change your mobile number, as we all do these days, you let the practice know what your latest number will be. There are loads of options out there. Your GP will often be able to advise you on the phone if you need to see them, and about half the telephone consultations I do don't result in the patient needing an appointment, because I can give them advice or even offer a prescription over the phone. So if you're busy, as we all are, think about one of those other options first.